10,000 years ago, someone drilled a hole into another person's skull. No anesthesia, no sterile instruments, no concept of infection, of germ theory, of the brain's function. Just a flint tool, a steady hand, and something that looked enough like intention to be called surgery. And the patient survived. We know this because the bone grew back. For most of human history, we have imagined our ancient ancestors as helpless in the face of illness. No medicine, no knowledge, no tools. You got sick. You either recovered or you died. And the people around you could only watch. But the archaeology tells a completely different story. Ancient humans did not simply accept illness and wait. They treated it with a sophistication, a tenderness, and in some cases a surgical precision that modern researchers are still struggling to fully explain. In 1957, archaeologist Ralph Solecki, excavating Shanidar Cave in northern Iraq, uncovered the skeleton of a Neanderthal man who had lived approximately 45,000 years ago. What he found in the bones stopped him. This individual, now called Shanidar I, had survived to middle age with injuries that should have killed him. A crushing blow to the left side of his skull that would have impaired his vision. A withered right arm amputated below the elbow, likely from birth or early childhood. Severe arthritis throughout the body. A healed fracture in the foot that would have made walking painful. He could not have hunted. He could not have traveled easily. He could not have fed himself reliably on his own. And yet, he lived for decades in a world with no permanent settlements, no agriculture, no safety net of any kind. The only explanation is that his group kept him alive, that other Neanderthals fed him, protected him, and cared for him when he could not care for himself. This is the oldest evidence we have of what happens when someone gets sick. Not medicine, not treatment, something more fundamental than either. The decision, made by people with no language to articulate it, that this person was worth keeping alive. In 1991, two hikers in the Alps discovered a frozen body emerging from a melting glacier on the Austrian-Italian border. He was 5,300 years old. Ötzi the Iceman has since become the most extensively studied human body in history. And what he carried when he died revealed something extraordinary about ancient medical knowledge. Strung on a leather cord around his wrist were two pieces of birch polypore fungus. Modern analysis confirmed that birch polypore contains compounds with antibiotic and antiparasitic properties. Ötzi's gut contents showed he was infected with whipworm, an intestinal parasite. The fungus he carried was a documented treatment for exactly that condition. He was self-medicating with a pharmaceutical agent whose active compounds science would not identify for another 5,000 years. Analysis of Ötzi's tattoos, 61 marks distributed across his body, showed they were located with remarkable precision over acupuncture points used in traditional Chinese medicine for treating the exact joint conditions his skeleton showed evidence of. Acupuncture was not documented in China for another 2,000 years after Ötzi died. Either the knowledge arrived independently, or it is far older than anyone has been willing to date it. Either way, a man walking through the Alps 5,300 years ago was carrying a functioning pharmacological treatment and wearing a map of his own pain on his skin. The drilled skulls found at sites across Europe, Asia, and the Americas represent the oldest confirmed surgical procedure in human history. The practice is called trepanation, the deliberate removal of a section of skull bone using a sharp implement. Over 1,500 trepan skulls have been found across archaeological sites worldwide. The oldest confirmed examples date to approximately 6,500 BCE in France. What makes them astonishing is not the procedure itself. It is the survival rate. Analysis of the bone healing around trepanation wounds shows that in many prehistoric sites, survival rates exceeded 50%. In some populations, reaching as high as 80 to 90%. These were not accidental wounds. The precision of the cuts, the consistent circular technique, and the evidence of multiple trepanations on single individuals suggest practitioners who had trained, who had observed outcomes, who had developed something approaching a repeatable method. We do not know why they did it. Theories range from treating head trauma and seizures to releasing spirits believed to be causing illness. Most likely, It was both at different times, in different places, by people who could not have articulated the distinction between the physical and the spiritual, because no such distinction existed yet. Around 1600 BCE, an Egyptian scribe copied a medical text that researchers believe dates to an original written between 3000 and 2500 BCE, making it one of the oldest medical documents ever found. The Edwin Smith Papyrus describes 48 cases of injury and illness in a format that is startling in its modernity. Each case includes a title, an examination, a diagnosis, a treatment, and a prognosis. No prayers, no spells, no supernatural intervention, just observation, classification, and recommended action. Case after case describes surgical management of head wounds, spinal injuries, fractures, and infections with a clinical precision that reads less like ancient superstition and more like an emergency room protocol. For wounds, the physician judged treatable. The papyrus says, treat it. For wounds he judged uncertain. It says, contend with it. For wounds beyond treatment, it says simply, an ailment not to be treated. This is triage, written 3,500 years before the modern emergency room formalized the same three categories. In 2023, researchers published findings in Frontiers in Medicine describing an ancient Egyptian skull dating to between 2687 and 2345 BCE, showing evidence of surgical intervention around a cancerous lesion, with cut marks indicating the tumor had been scraped or excised and the patient had survived long enough for the bone to partially heal. The oldest known attempt at cancer surgery, 4,500 years ago, by a physician working with copper instruments and no knowledge of what cancer actually was. What ancient humans did when someone got sick was not nothing. They carried fungal antibiotics on their wrists. They mapped their pain onto their skin and treated it with needles. They drilled holes in skulls and kept the patient alive through recovery. They wrote clinical protocols for trauma surgery that a modern physician would recognize. And before any of that, before the herbs, before the surgery, before the papyrus, they simply stayed. They fed the man who could not feed himself. They protected the person who could not walk. They kept alive someone who offered nothing in return, except the fact of their existence inside a group that had apparently decided that was enough. Every hospital, every pharmaceutical compound, every surgical technique and clinical protocol that exists in the world today is the descendant of that first decision. Made by a Neanderthal in a cave in northern Iraq, 45,000 years ago, to not leave someone behind. We did not inherit medicine from science. We inherited it from compassion. And the science came later, built on top of something that was already ancient before the first word was ever written down.